HPV testing is obviously an enormous advantage now that we have, an enormous plus, but we have several issues with HPV. HPV is not a disease per se, it's just a risk factor. So a woman that has a positive HPV test does not have a cancer. And you have to control, you will have around 10% of the general population who will be positive for HPV. But you will not have 10% of the general population that will have a cancer. So you have to find out those women who are HPV positive and who have a cancer or a pre-cancer. And for that you have not so many options, and cytology remains one of the best options because it will sort out the cases with just an increased risk due to HPV and the cases with really already a cancer or pre-cancer in evolution. And then you have another point, that is that if you look at, whereas almost every case of cervical cancer is due to HPV, but if the cancer progresses, or the pre-cancer progresses, then the viral load will go down. And with traditional and standard HPV tests, you will not be able anymore to show the presence of HPV. So you have, in all the cases, you have cases of let's say, high cyt, which is a precursor of cancer. Around 10% will be negative for HPV in standard routine HPV tests. And that's a problem, because if you see such a patient and you do an HPV test and the HPV test is negative, then you think, well, the patient has nothing, she's healthy, and you tell her to come back in 3 years or 5 years, but in fact she has something, but you are not able to find it. And for this reason, making both tests, the HPV test and a cytology test, which would be called a co-testing, is the best option. It is obviously the most expensive option, but that now you have to see what do you want to do. What is the priority? Is the priority finding most of those women with the risk of cancer, or is the priority purely financial? Well, I had quite some expectations, for the reason that I took the lab in 2005 with purely conventional cytology, and then it ran like this for several years, and in 2014 we changed for liquid-based cytology. And we found much more positive cases, which were all then confirmed by histological controls. So I was already very happy that our detection rate went up very high. Obviously, digital cytology will, my expectations were several types. The first is that the new algorithm in the digital cytology will be able to be even more sensitive than the old imager from Hologic. So your detection rate will be higher. Your accuracy, your diagnostic accuracy will be better, because what the Genius Digital shows you is more precisely what you should see in order to make a correct diagnosis, and a gain of time also. And that is obvious. We do a diagnostic with, let's say, 1 minute more or less on the new system, and you needed 3 to 4 minutes with a microscope. So the time gain is enormous. I had also my fears about it, and this principal fear is obviously you leave what you know, which is microscopy, and you have to go to looking at the screen. That's if you simplify terribly. So you change completely your view of things. But I think give it a try, as we did in Luxembourg, and you will be surprised about the results. That's what we were also. If you are in my team, there is nobody who said, even after 1 week or 2 weeks, oh, I would like to go back to the microscope, this is not good. Everybody was convinced that the system was better and easier to use. And I think, give it a try and you will see. But for me, it's really an advancement, an increase in quality due to this new system. Yes, of course, because the system doesn't make a diagnostic. The system just presents you with objects of interest, cells that you have to evaluate, and the human being has to evaluate them and to put a diagnosis on that. So for the moment, the cytotech is needed more than ever to use the system and to make the diagnostic. And this will not change in the coming years.